All right, good evening, everyone. Welcome to this coronavirus special. I am Scott McGee. We are here every night with an expert to help you, well, just answer some questions about this very confusing time. First, we want to get into some of the latest numbers for the Hudson Valley, then we'll get to those questions. There have now been 8 deaths and nearly 6,000 cases of coronavirus in Westchester, almost 1,200 cases, 7 deaths in Rockland, 750 cases with 3 deaths in Orange County, 2 deaths, nearly 200 cases in Dutchess, and 109 in Putnam, 78 in Ulster. Those numbers going up exponentially by the day, as we have expected. Now, tonight I've got Dr. Caroline DeFilippo. She joins us to answer these coronavirus questions. Dr. DeFilippo is an internist and assistant medical director at CareMount Medical. So we want you to email your questions or put those in our Facebook message. We'll try to get to as many as we can. We've got a whole bunch that have already come in over the last couple of days. So let's get to those right now. Dr. DeFilippo, first of all, thank you for joining us. How are you feeling today?
Thanks for having me tonight. Feeling okay. It is a pretty uncertain time that we're in. I'm glad to be here to be able to answer questions. I think the most important thing that we can all be doing is listening to reliable and credible sources and trying to get the news out there of what we know and also what we don't know. So tonight is really important, and I'm grateful for all the questions that have come in so far.
I am grateful for you to be here to answer those questions because it just seems like every time we answer a question, another one comes along. So let's go to that first one. Let's talk about some of the things the governor's been talking about a lot. It's this wave of patients that we know is coming soon, and we can sort of feel it as those numbers go up. Hospitals, we've been hearing, are in very short supply of beds. Ventilators is a real problem. Masks. How bad is the situation from the doctors that you have talked to and from your own perspective in terms of just getting the tools that you need to do your job?
Absolutely. So thank you for asking that question, because that's probably the biggest question that's on the mind of all of the healthcare professionals, doctors, nurses, respiratory therapists who I've been speaking with. So the answer is it's variable. We do need more supplies without a doubt. I am an outpatient internist working in a multi-specialty private group, so I can tell you in my group we do have the supplies we need at this time, but I am also aware that many of the hospitals and other groups surrounding us have very limited supplies. It's frightening because we're going into situations without, I like to liken it to being a soldier going into a battle without having your armor, without having your protection on. And so it's essential that we have what we need. The governor is doing a great job of sharing with people about the dire warnings and also encouraging people to stay home if they don't need to enter one of those areas so they don't add to either their own exposure or expose other people to coronavirus if they indeed do have it. So supplies are limited. There is an effort underway. People are doing a great job with stepping up with donations, with connections to folks all over the world and giving us the help we need in New York, but we've got a long way to go.
I got to ask you if it sent a shockwave through the medical community today that this nurse in New York has died, a nurse in his 40s, apparently in perfect health. We've all been thinking if you're under the age of 70 and you're in good shape, you'll be fine. That tells us that's not true.
Yeah, we're seeing a lot of cases amongst healthcare workers, some of them very young and otherwise healthy individuals, and it does make you pause and worry about, is that related to them having just an incredible exposure to the virus, seeing it over and over and over again, and would additional protective measures helped and prevented that? I don't think anybody can say with extraordinary certainty that it would have prevented it, but it absolutely would have lessened the likelihood of something like that happening. And it is scary to see one of our own out there with something that, should not have happened.
Yeah, very concerning. Now, so with that in mind, a couple more of the questions we've been getting from Facebook. This one, I've heard the answer myself, but I'll let you do it. Is the coronavirus mutating from what we know? Should we be worried that perhaps a new strain could hit us after this first wave?
So from what we know right now, it does not appear to be mutating. However, this is a type of virus that can mutate quite easily. So we know there are 2 strains circulating. There was one initially in China, and there's a somewhat different one that's circulating now. And the fact that we've even seen 2 strains in this relatively short period of time makes you think it is a virus that can evolve. I don't want people to have the false sense of security in saying I was exposed to corona, I had corona, and now I'm safe. We don't know with certainty what that safety means. How long does it last? If another strain comes along, how will we know? When will we know? So there are a lot more questions than answers to that. So as of right now, it's not mutating, but it has that ability. And what does that mean for future protection? We're not certain.
All right, so let's now talk about something that it seems to be holding so far, and that is most people, the vast majority, somewhere around 80%, either have mild and perhaps even no symptoms.
Yes.
So if you do test positive for the coronavirus, what's the right treatment?
Right. So first thing, I can't say this enough. 80% of people have a very mild case of this. And by mild, you may feel sick. Please don't misinterpret that to say, you know, I won't even notice it. No, you may feel under the weather. You may be under the weather for quite some time. But mild in this definition means you don't need to go to the hospital. You don't need to go to the emergency room. You can manage on your own at home without any additional significant prescription medication. So that's the vast majority of people. And I think that is important to just keep saying that over and over again. To be okay if we get this. Now, if you are one of these people who you think you do have it, you're having symptoms of any sort, call your healthcare professional. Do not come into the office, call. One of the things we've done really well, really quickly across New York State and the country, but particularly at CareMount, is we've got a triage system in place. So when patients think they're having symptoms, they give us a call and we can assess on the phone how well they are doing. We are doing virtual visits for more and more of our patients, and I can't tell you the benefit it is giving us to be able to see a patient and get a sense of who is really needing additional care and who is not. So the good news is most of those people fall into that bucket. They can call their doctor, they can see their doctor virtually, and then we can make an assessment to say, you know what, stay at home, but keep an eye on your symptoms, call me in another day or two, watch your temperature, let me know how you're doing. If you are having fevers, Tylenol is absolutely fine. You should treat your fevers. If you are having cough, you can take cough medicine as long as you are safe to take cough medicine for other reasons. So treat your symptoms is what we're telling people. Rest, stay home, stay well hydrated. So that's sort of the main message for the 80%.
Good advice right there. Okay, so let's talk about some of the sort of the side things that I think a lot of us, if not all of us, are dealing with. For instance, I tried to go and buy some food for delivery. There was no open spaces. A lot of people are getting their food delivered right now. So if you are one of the lucky ones, you can actually get a box of food delivered to your house. What do you do with that food? Like, is the food in the freezer? Will the freezer kill the virus? How much do you have to wash your fruits and vegetables, even the boxes inside? You know, how should you treat that stuff?
Yeah, so I actually would extend this question to anything that's coming in your house from the outside world. So, you know, if you want to talk about your mail, if you want to talk about your Amazon orders or anything else that enters your home, take general precautions. I think that's the best way to look at this. So specifically with food, you should always be washing any fruits or vegetables. That does not change here. I want you to wash your fruits and vegetables. Things that are packaged generally are going to be okay from what we can tell. It's not a foolproof answer, so I can't tell you 100% that's going to be okay, but my gut on this is that, you know, use your common sense. Wipe down anything that looks like it's soiled. Fruits and vegetables, absolutely. If food is going to get cooked, we can presume the virus is going to be killed. So if you have, you know, for example, ground beef, you're going to cook that before you actually eat it. And as you're cooking that meal, you're going to be washing your hands after you touch everything. So the key is really using the basic principles of hand hygiene that we would use normally, but really apply it all the time now. Don't forget. Yeah. So before we eat dinner, we always wash our hands. Before we prep a meal, we always wash our hands. You got to keep doing that, and you need to be extra vigilant about that now.
And just ignore the fact that your hands feel like lizards now because of the amount of alcohol and washing. My hands feel like they're made of some sort of lizard skin at this point. All right.
You got it. Soap and water work. Soap and water.
Does work.
It absolutely works.
It is a little rough on the skin after a while, though. All right.
So true.
Okay, so moving on to maybe a more specific question we got on Facebook. Do you recommend using a CPAP machine, which for those people who don't know, those are the masks that go in your nose to help you not snore, for people who may have, say, a mild case of this virus?
Yeah, so CPAP machines. So CPAP machines are used for an illness called obstructive sleep apnea. And that's a really important illness to treat because people who have untreated obstructive sleep apnea, or OSA, as we refer to it, because it is a tongue twister, they can have a lot of serious health consequences, you know, not necessarily after missing one night of the mask, but over a long term. So one of the messages I really want to make sure everybody hears tonight is you need to keep treating your underlying medical conditions. So if you do have OSA and you need to use a CPAP, you should keep using your CPAP. That is a closed device or a closed circuit device. So what that means is there's tubing attached to it and into a machine, and a mask goes over the person's face. So all that air should be contained within that cycle there. If you are known to be infected with the virus and you do normally use a CPAP, I would prefer that you are not using that in the same room as someone else who is not known to be infected. So I would want to limit anyone else's exposure to that. But I also don't want someone who's infected not to take care of themselves and treat their underlying health conditions in addition to COVID.
Okay, we got time for one more quick question. Let's talk about pets. We get a lot of questions about pets. Can we give it to our pets? Can the pets give it back to us? What's the deal with that?
I don't think we really know. From what we can tell, the answer is probably a no from right now. I don't think there have been any reported cases in our common household pets. I will say I'm not a veterinarian, so I wouldn't be the best source to answer this one. But same thing is going to apply here with your pets, as I said about hand hygiene. I want you to be careful in touching your pets. There are plenty of other things that can go back and forth between us and our pets. So I would say just keep being vigilant about washing your hands and doing everything you would normally do. But from what I can tell right now, we're not seeing evidence of it crossing between humans and pets.
All right, so you can still love your pets. That's the important
Please,
part.
And that's the best thing for your mental health. Give your dog, give your cat a snuggle. It really helps.
It does. That blood pressure goes right down. The science is pretty clear about that, right?
Dog adoptions are up from everything I've heard. People are really reaching out and getting a pet right now. Nothing wrong with that.
See, positive, there's always a positive, you know, that little silver lining. Okay, I tell you what, we're running out of time. We're going to take a quick break, everybody, but we're going to be right back with the doc here in just a sec. All right, welcome back, everybody. We're having our special coronavirus informational, we'll call it that. We've been taking some questions from Facebook. You can turn to that. You can email them to us. We are joined by Dr. Caroline DeFilippo, internist and assistant medical director at CareMount Medical. So Dr. DeFilippo, tell me some of the, we were talking just in the break there, and you've, I imagine, here a lot of myths. Things that the internet is great and it is also terrible in some ways, and spreading myths is one of those terrible things. What are some of the things you're hearing that you'd like to dispel?
Yeah, so the first thing is, you know, right now, anything to do with treatment for COVID-19 in terms of specific medications is really being reserved for extremely sick patients in a hospital setting. So there are many medications being spoken about in the media, and I would really encourage people to just pause before calling and saying, I need a prescription for something right now. We don't know yet what medications really ultimately will be successful in treating this, either in a hospital setting or an outpatient setting. Some of the medications in particular have other uses. There are drugs that are used for HIV or for people with chronic autoimmune conditions. And the last thing I would want to have happen is people who rely on those drugs every day for a previous medical condition can't get access to the medications they need based on a misconception that this might help treat coronavirus. We don't know yet what the right treatment is. We are working to find an answer, and I'm confident we are going to keep working towards that and get something soon, but we don't know yet.
With that in mind, there's been talk about trying to sort of loosen some of these restrictions by Easter. As someone in this world, what are your thoughts on, do you think we'll be ready by Easter?
I think it's premature. So, you know, as right before we came on, I saw the latest statistics, and we are now leading the world, which is not something I would be proud of in the United States in terms of the number of cases with COVID-19. So I think we are still very much as a country, and especially in the New York metropolitan area, on a very steep upward trajectory. I am hoping we will start to see that level off as all of the work with the social distancing that people have been doing start to pay off. But this is a tricky virus because there is such a lag time between the actions we're taking now. We see the results in about 2 weeks. So it's really hard to project and know how much benefit we're going to have from that until we just have a little more time. So I'd love to say we'll be doing great by Easter, but I think that's a little too soon, and my guess is that probably will not come to fruition, at least in our part of the country.
Gotcha. Yeah, and New York may be separated with some of the other states that have it really bad. All right, let's go to another quick question from Facebook. How is this really spreading? If someone sneezes on me and they have the virus, I could get it. But if someone that is infected sneezes on, say, a shopping cart, right before I use it, how can I get it? I touched the cart but didn't touch my face, wiped my hands with some hand wipes when I got in my car. Am I safe?
So I hope so. So you're doing everything right, whoever asked that question. Washing your hands, wiping the cart, not touching your face, especially when you're out in public, those are the key things. So the virus is spread through droplet. So coughing, sneezing, that's how you can get exposed to the virus. But it can also stay alive through fomites on surfaces. So if you did happen to sneeze, or if something else that you had that had the virus on it touched another surface, the virus can stay alive for a number of hours on those surfaces. So what we really recommend is when you're out in public, clean anything that you're going to be touching. If you have the ability to wear gloves, some people are choosing to do that. I think that's a personal decision, also depending on how well your hands are doing, how red they are. But you really want to make sure anything you are touching has been cleaned.
And the problem is if you have gloves and you touch something and then touch your face, it doesn't matter if you have gloves. They're not really doing any good for you.
It's a false sense of security. I think a lot of people I see with their gloves on doing their hair, and I'm like, no, you haven't helped yourself at all.
All you've done is prevented it from getting on your hands, which is not the problem.
Got it.
Okay, so here's a good question from Facebook. If a child gets the virus and has a need to be hospitalized, can the parent go to the hospital? Now, that's probably hospital specific, I know, but what have you been hearing talking to doctors?
So I think the key to that question is, children getting the virus is a very low percentage of children, so extraordinarily low. And then children who get the virus having a severe enough case to be hospitalized is even smaller. So the likelihood of that scenario occurring, I just want to be clear, is very, very small. Should that occur, that's going to be a hospital by hospital decision. So a lot of the hospitals in our area are making policy choices that are changing by the day. And so I can't give you a blanket answer to that right now. The bottom line is if your child is severely enough ill that he or she needs to go to the hospital, please bring them to the nearest hospital, regardless of that policy. Get them the care they need. One of the things that I'm really happy about being at CareMount is that we have these virtual visits. So if there is ever a doubt in your mind and you're saying, I don't know, they seem sick, but I don't want to bring them in, use a virtual visit to see your doctor. So many of the groups in this area are leading the way, having virtual visits to help take that burden off of you so you don't have to make that decision. Your doctors are here. We all want to work. We want to take care of our patients, and we want to guide you through this. So reach out to us.
Another question from Facebook. Are there symptoms other than fever and cough? I have been hearing that they kind of been running the gamut from what I've been hearing from people.
Yeah, quite a broad range. So I think this is also one of those things that has evolved dramatically from what we first read coming out of China to what we're experiencing today. So fever and cough, absolutely, but not everyone with this has a fever. The cough is often dry, but not always. A lot of people are reporting headaches. People are reporting gastrointestinal symptoms, diarrhea, loose stools, and then a lack of smell is the latest symptom that's really created a lot of buzz on social media. But I have to tell you, anecdotally, I have seen many patients who have given me the story, yesterday I just didn't enjoy my food, and today I woke up with a fever. Could this be it? Most likely, yes. So those are some of the most common symptoms: body aches, fatigue, feeling run down. Now, the challenge with this is those symptoms can go with so many different illnesses. We still have influenza circulating in the community, RSV, which is a common respiratory virus. So it's always important, if there's ever a doubt, give us a call. Talk to us. Let us help you work through that to figure out what you should do.
Okay, doctor, thank you very much. We're going to take another quick break, but we're going to be right back with our coronavirus special in just 3 minutes. All right, welcome back to our coronavirus pandemic special. We are joined by Dr. Caroline DeFilippo. We got just a couple minutes here. So, Dr. DeFilippo, let's talk about anxiety. I was saying to you earlier, I feel like every day it's sort of like Game 7 of the World Series. Maybe not the 9th inning, but you just have that pit in your stomach every day.
Yeah, absolutely. So this is a marathon that we are running right now, and it's a marathon where we're not quite sure where the finish line is going to be. So it is so important that people are taking care of their physical and their mental health right now. And I can't stress that enough. We are physically isolated from each other, but we are not socially isolated from each other. So reach out to friends and families, talk to people. If your normal routine included going to the gym and that was your stress relief, there are YouTube videos, there are all sorts of different things you can do to continue to take care of your mental health. You just have to be a little creative and thoughtful about what that looks like, especially if you've got young kids in the house and you're trying to do homeschool and balance it all as we are here. Just make sure you continue to carve out that time for yourself. so you can keep running this marathon.
All right, very quickly, what is your message to people who have underlying conditions that are maybe afraid to go to the doctor right now?
Please check in with your healthcare providers. We are really worried about all the people who may have coronavirus, but we are also worried about our patients with chronic conditions, that they don't miss important care that they need. If you are a diabetic, if you have high blood pressure, chronic respiratory illness, we want to make sure you continue to get the care you need. So if the virus is keeping you out of our offices, call us, do a virtual visit, check in with us. The last thing we want to have happen is you have something unrelated to this pandemic happen to your health that could have otherwise been preventable.
Dr. DeFilippo, thank you so much. Some great information today. Everybody, take care of yourself. We'll be right back.